Madam President.
Senator from Iowa.
Madam President, I guess I'm compelled to say here we go again. We've been down this road a few times before since we passed the Affordable Care Act. Let me see, my notes tell me it's 33. This makes the 34th time that someone on the Republican side has tried to do away with the Affordable Care Act. Oh yes, this is the 34th time. And they failed every time. They failed every time, but so, free to offer amendments, understand that, respect the senator's right to do that. But, we've already made our decisions on this, and we're moving ahead. Now, I've said many times, as the chair of the Health Committee, I've said many times, if someone has suggestions on how to improve the Affordable Care Act to make it work better, be more efficient, I'm open for that. That should be allowed, and we should have a constant kind of exchange on maybe how we can improve it. But this idea we're going to repeal it, well, I'd also say, Madam President, that I wonder if my friend, the senator from Texas, saw the last election. No, the senator from Texas got elected, that's for sure. Can congratulate him on that. But the presidential candidate of the Republican Party who said he wanted to repeal the Affordable Care Act didn't make it. He lost. President Obama, who was the president who initiated this and signed it into law, he won, I think quite convincingly. So the American people basically said, it's time to move on. Time to move on with the Affordable Care Act. And yet here this amendment basically would repeal it. But I wonder if the senator from Texas understands that it's not just the Affordable Care Act that his amendment would hit. It would hit a lot of other things. When we passed the Affordable Care Act, there were authorizations for other programs that were included with it. And so when the amendment says, well, you can't fund any of the provisions of the Affordable Care Act, well, I just made a note. We also reauthorized the Nurse Training Partnership Act. So a lot of the funds there go for training nurses. Now, does the senator really believe we should stop funding nurse training in America at this time when we need more nurses and more nurse practitioners than ever before? At a time when our nursing profession is facing a kind of an age cliff. We have a huge cohort of nurses now that are going to be retiring. We need to bring in new nurses, and yet his amendment would cut funding, say that nothing that we could do could support nurse training programs yet in America. School-based health clinics, Medicare fraud and abuse. Fighting fraud and abuse in Medicare was also included in the Affordable Care Act. So, Madam President, again, they've tried frontal assaults on getting rid of the Affordable Care Act. Now this amendment says we're just going to not fund it. It'd be strange. We have the law in effect, but no funding to take advantage of it. It's almost like there's an obsession. There's an obsession with some people on the other side of the aisle with tearing down health reform. Again, I think it's unfortunate that some missed the results of the last election. So it's time to move on. This amendment really is the equivalent of repeal. It would turn back the clock on all we've accomplished over the last year. The administration would not be able to build the insurance exchanges or to enforce the Act's requirements on private insurers. Again, what this amendment, if it were adopted, would mean we'd go back to the good old days when the insurance companies were in the driver's seat telling you what kind of health care you were entitled to and when you're entitled to it. And again, ever since we passed the Affordable Care Act, and during the time that we debated it here on the floor, we kept asking our friends on the Republican side, what's your alternative? What's your alternative? What's your alternative? And basically what we got was the status quo. Let's just stay with what we got. Well, I think the American people got pretty fed up with what we had, where insurance companies could turn you down at the very moment when you got sickest. You know, when people had pre-existing conditions and couldn't get insurance or had to pay exorbitant prices for that. I had to hear a note on, we had a family, the Grasshoffs from Texas, Senator's home state. They were unable to find coverage to pay for their son's hemophilia treatment. Why? Because they had reached their lifetime limit on insurance payments. Well, the Affordable Care Act bans lifetime limits. So now they can get treatment. More than 100 million Americans are currently protected by this provision. This amendment would take it away. So the Grasshoffs treatment for their son for hemophilia treatment would end. And they can't afford to pay for it out of their own pockets. Keep that in mind when you vote on this amendment. The Affordable Care Act allows young people to stay on their parents' policies, we know, until they're age 26. More than 3 million young people are taking advantage of this right now. You know, repeal would take that away from families. I mean, the repeal, the adoption of the Cruz Amendment would take that away. Because, obviously, we couldn't fund anything to help make this work. Again, I mentioned pre-existing conditions. People have high blood pressure, diabetes, heart disease, previous bouts of cancer. Right now, the Cruz Amendment would say, no, insurance companies could say, no, we're not going to insure you. Or if we do, you're going to pay sky-high prices for your insurance. One of the big things that we put in the Affordable Care Act was prevention and wellness programs by preventing illness. And so we provided for free preventative services like mammograms and colonoscopies. So they don't have to, people can get those without paying co-pays, as much as sometimes $300 to several $100s for these essential services. Well, the Cruz Amendment would put you back, or you'd have to pay for those preventative screenings. Cruz Amendment would deprive states and localities of vital funding to combat chronic diseases like cancer, diabetes, and heart disease, as well as funding to ensure that our kids have access to life-saving vaccines. The Prevention and Public Health Fund is saving lives. The Cruz Amendment would stop that. Now, I picked up a little bit of what the senator from Texas said about young people, their insurance rates are going to go sky high and stuff. Well, has the senator ever heard of the marketplace? It's where people compete, right? Well, under the Affordable Care Act, all of these insurance companies now will have to go on the exchanges in the open market with full transparency, and they're going to have to compete. Now, we haven't had that in the past, but under this we do. Cruz Amendment would take that away. Take that away. A real market out there for insurance, for individuals, small businesses, would have the same purchasing power and choice that only big companies have had before. Well, I guess most importantly, these exchanges that we're setting up will bring coverage to 32 million Americans who don't have coverage right now. They live in the oppressive fear that they're just one illness away from bankruptcy, losing their homes, not knowing if they can afford another doctor's visit. Would anyone tell states, stop this, stop what you're doing to help serve your citizens? Well, that's what the Cruz Amendment does. Cruz Amendment would take us back to the days of the donut hole For elderly, because the Affordable Care Act closes that donut hole, we're closing it year after year. 6.1 million seniors have already saved more than $5.7 billion in discounts on drugs purchased in the donut hole. The Cruz Amendment stopped that. It would increase seniors' drug prices by an estimated $3,500 per person over the next 10 years. One of the key features we put in the Affordable Care Act was going after Medicare fraud, preventing Medicare fraud. We've increased criminal penalties. We've launched innovative technologies to detect and pursue those who would defraud Medicare. We've put more cops on the beat to preserve Medicare funds for beneficiaries and not those who would scam the system. Cruz Amendment would stop all that. Stop our efforts that we put in there to get a handle on Medicare fraud. And something very important to so many of us is what's happening in rural areas. Now, right now, under the Affordable Care Act, there are incentive payments paid to rural primary care providers in rural America, in states like North Dakota and Iowa and Texas. Well, right now, the Cruz Amendment would stop that incentive payment for primary care providers in rural areas. I mentioned the preventive services. Right now, every senior gets a wellness visit once a year. More than 34 million seniors got that last year. A free preventative service in Medicare so they can go in and get a wellness check to find out if they need to do something to take better care of themselves. And they don't have to pay for that. The Cruz Amendment would say, now, if you want to do it, now you got to start paying for it. Well, now, since this is a kind of a blunt instrument, this amendment we have before us, it would defund all activities related to health reform, all activities related to health reform, including paying the federal employees who administer Medicare. Well, Secretary Sebelius has informed us that payments to Medicare providers would be significantly disrupted by this. You just can't separate out the Affordable Care Act from all the other provisions of Medicare that are being run by Health and Human Services or by CMS, the Center for Medicare Services. Well, Madam President, oh yes, I know the Senator also talked about the deficit, reducing the deficit. I don't understand why someone would want to stop something which the Congressional Budget Office said would reduce the deficit in the future. So I guess we're going to reduce the deficit by increasing the deficit. That's sort of the logic of this amendment. The Congressional Budget Office confirms that the Affordable Care Act reduces the deficit by more than $100 billion in the next 10 years and more than $1 trillion in the decade that follows. So the Cruz Amendment would roll that back. So I guess the senator wants to reduce the deficit by increasing the deficit. And, go figure that one out. So it's really time to stop the silly games, but I guess it'll continue. After all, in 1935, the Congress and President Roosevelt passed the Social Security Act. 75 years later, there are still some on the Republican side that would like to get rid of that. So I guess we'll continue to have a few voices, not everyone, but a few voices that will still be fighting the Affordable Care Act years from now. In 1965, Congress passed Medicare. Republicans fought it bitterly, by the way. 45 years later, a few on that side are still trying to undo Medicare with voucherizing it and all that kind of stuff. So I can just say, here we go again. I always remember what William F. Buckley the founder of the National Review, sort of the godfather of the modern conservative movement in America. You know, a very intellectual kind of guy. He was very intellectual and a good writer and a good speaker. I always enjoyed watching William F. Buckley. He once said, and this is a quote, he said, "The role of conservatives is to, quote, stand athwart history yelling, stop." Well, is that really the role? Well, I think there should be a different role for conservatives, and that is to stand with liberals and moderates and everybody else in figuring out what's best. What's best for moving ahead? Not to just yell stop or to repeal something, but something that is so meaningful and so broadly supported. Then how do you make it work the best? So I kind of conclude where I began. If people have suggestions on how to make the Affordable Care Act work better, work smoother, be more efficient, more cost-effective, fine. I'd like that's good. That would be a good debate and discussion. Not so much debate, discussion to have, but just to say no, we're not going to fund it. That's an ideological approach. It's not based on budget considerations, not based on reducing the deficit, which I've just pointed out. It's not based on I think, a rational reading of the bill itself and what is happening out there in terms of setting up the exchanges and all the other things that I just mentioned. It's just an ideological approach. It's sort of tearing it down and sort of going after President Obama, I guess, one more time. So I don't want to take the position and say that somebody can't offer an amendment like that. Sure, you can offer an amendment to do anything. But reasonable, rational people here in the Senate don't need to follow that. We just need to do what is best for the American people and leave the ideology behind. So I hope that the Cruz Amendment will be seen for what it is, an attempt to repeal Obamacare at this moment in time, when we're on the cusp of actually having it fully implemented. States have already moved ahead. Even very conservative Republican governors have joined in and saying, yes, we want to extend Medicaid coverage, federal Medicaid coverage in our states. Conservative Republican governors are setting up exchanges. So we're moving ahead. Now's not the time to sort of say, well, we're going to cut the funding for this. And again, keep in mind that this doesn't just defund Affordable Care Act. I said there were other things like nurse practitioner, the Nurse Profession Training Act that we put in the Affordable Care Act. That would be defunded also because it's part of the Affordable Care Act. It was reauthorized along with that, along with Medicare fraud and abuse, school-based health clinics,
Area health education centers.
Oh, yeah, the area health education centers, a number of things that were put in with the Affordable Care Act that would also be defunded under the Cruz Amendment. So I hope, Madam President, we'll see this amendment for what it is, and I hope the Senate will soundly reject it. Then I yield the floor.